When your dog and cat comes in for a professional dental cleaning with us at Petsadena, these are the types of machines and equipment that we use to make sure that your pet is safe under anesthesia and perform the procedure itself. This is the pre-anesthetic exam. We evaluate every patient prior to anesthesia to make sure they're healthy to go under anesthesia. This is the pre-medication. This is a opioid pain injection along with a sedative to calm them down and prepare them for anesthesia.
Now I am shaving her arm to make it a cleaner area to place the IV catheter. These are the items we're going to use to place our little dog under anesthesia.
We use an injectable anesthetic called propofol. We give that injection in the vein that will allow us to get them to a level of anesthesia where they're unconscious and we can go ahead and intubate them. So this is our anesthesia monitoring device. This allows us to look at multiple parameters while they're under anesthesia. So we have our EKG here that tells us their heart rate and rhythm. We still utilize stethoscopes to listen to them. You always want to make sure that your patient is what you're monitoring, not the numbers on a machine. We also look at the SpO2, which gives us the oxygen saturation. Our end-tidal CO2 is the carbon dioxide level. That tells us that the body is oxygenating appropriately. We also can see the respiration there. At that level, we want to make sure that the animal is breathing on their own. If for whatever reason they're having difficulty breathing on their own because they might be under anesthesia a little too deep, we can go ahead and manually breathe for them. We also check their temperature. That's allowing us to make sure that the temperature doesn't drop too much. This is the blood pressure parameters. We want to make sure that they maintain the blood pressure. This blood pressure monitor is taking parameters every minute, and we're recording all these parameters every 5 minutes on our anesthesia monitoring sheet as well. But as the procedure's going, we're making sure we're assessing our patient on a regular basis.
We're taking x-rays and we want to make sure that we get the whole root in the picture, just so we can see if the root is infected or the tooth is in any risk of an infection.
So after the technicians have taken all the x-rays needed, the doctor will go ahead and review the x-rays and look for any abnormalities.
The next step in the dental is to record the findings and probe each tooth with this instrument here. We're going to check for periodontal pocketing. If this slips more than about 3 or 4 millimeters, it indicates there is disease there. During a dental procedure, we use this scaler to remove tartar from the teeth.
So when you scale and you get a lot of bleeding, that's from the tartar buildup up there, and the gingivitis is basically starting to perform in there.
The next step after scaling is polishing to remove the microabrasions that we've created during the scaling process.
Hey guys, how's it going with the dental?
Great, thank you, Doc.
Alright, so it looks like we're finishing up polishing here. So polishing is very important after we go ahead and scale and clean the teeth to make sure that any sort of nooks and crannies that are left irregular on the enamel is going to go ahead and be smoothed out, because you can definitely get more bacteria and more plaque that gets built up because of irregularities there. So we definitely need to make sure that we go ahead and polish them and make sure that they're going to stay as healthy and happy as possible. Fun fact, guys, so definitely Unfortunately, a lot of owners like to buy tools at home to scale their own dog's teeth, and they remove the plaque off the teeth. We highly, highly recommend to not do that because they aren't able to polish afterwards. So this is the reason why we do polishing, again, to get all that irregularity on the enamel after we remove it, to prevent any further bacteria and any further gingivitis and all those things from happening. And so when you actually scale the teeth at home, you're causing more irregularity on the enamel. So we always recommend to not do that so we can properly clean the teeth, make sure we put the polish, and make sure we prevent, again, more bacteria from happening and more plaque from happening.
If there's no extractions, this procedure usually takes an hour and a half.
Now that the cleaning and polishing has been completed, the doctor comes in and does a thorough oral examination. So we'll probe all the teeth. We will look at the gums and look for any abnormalities like growths on the gums, any ulcers, sores, anything like that. That might be of concern. This is the only way to evaluate their mouth thoroughly, which is why we recommend professional cleanings under anesthesia.
The last step of our dental cleaning is to apply Oravet sealant to all the teeth. This dog didn't need extractions, so we're going to just do this right away. This gel protects the gum line from bacteria entering the bloodstream. And also, for the next 2 weeks, the owners are not able to brush, so this also prevents any tartar buildup for the next 2 weeks. Now that the dental is over, we're going to wake her up gently and watch her for the next 2 hours to make sure that she does well after anesthesia.
You did so good. Good girl.
We're going to put her in recovery and we're going to watch her for the next 2 hours.
Our patient recovered well. The procedure went very routine. This is what we like to see for our routine professional dental cleanings. And she will get to go home in a few hours after we ensure that she has recovered fully from anesthesia without any complications. Thanks for watching.